Hi and welcome back. So what we're going to look at now is the talus. Oops, sorry, let's just pick up my pen. Let's just make that slightly bigger first of all. And pick up my pen. Okay, so we're looking at the talus. And what I've done is I've removed all the other bones of all the other tarsal bones. So we are just left with the talus. And I can outline the talus there for you. As we go around. Okay, so this is the talus that we're looking at here. Okay, and remember the talus sits immediately inferior to the distal end of the tibia. And here's our tibia, and here's our fibula. Okay, so on the inferior surface of the distal third of the tibia, there will be an articular surface which will articulate with this articular surface on top of the talus. And this main central section of the talus forms the body of the talus. Okay, so that sort of main central section there is going to form the body of the talus. Now, we also have a neck. If let's just change my colour. Okay, we have a narrower portion of the talus, which is this area here, and that forms the neck of the talus itself. And then we have the prominent anterior aspect of the talus here. And again, sorry, let me just put that in a different colour maybe. This prominent anterior aspect of the talus here. So the anterior aspect of the talus. And that has an articular surface as well. So let me just clear that pen a moment, and that will allow us just to rotate the image a bit. So if we sort of rotate the image slightly, you can see that, and again I can pick up my tools. So we have this narrower portion in here, which is referred to as the neck of the talus, and the rest of this area up here forming the body of the talus itself. Okay, let's go back to our single image there. Okay, now the upper surface of the body bears a large pulley-shaped articular surface, and that's known as the trochlear surface, which is concave from side to side and convex from front to back. So let's pick out that trochlear surface then. Okay, so this is the trochlear articular surface that they are referring to, which articulates with the inferior aspect of the tibia. So this is our trochlear articular surface. And as we said, it's concave from side to side and convex from back to back. And this articulates with the lower end of the tibia. Now, if we move to, so let me just get rid of that a moment, and we just rotate, and we're going to rotate the talus medially. Okay, so we're going to look at the medial aspect of the talus. Ooh, sorry. Let's bring it back into focus a moment. Okay. Oops, sorry. Okay, so we're rotating medially. Okay, so this is the medial aspect of the talus here. So let's pick up some. So we are now looking at the medial aspect of the talus alone. Okay, so again, here's our talus. Just outline the shape of it. Okay, here's our talus. We've got the anterior aspect of the talus. We've got the trochlear surface in here. And what we need to pick out on the medial surface of the body, there will be a small comma-shaped articular surface which articulates with the medial malleolus. So here's our medial malleolus of the tibia, and there will be a corresponding comma-shaped articular surface on the talus as well. Okay, so medially, on the medial aspect of the body of the talus, we have an articular surface which articulates with the medial malleolus. Now, if we then go to the lateral aspect, so if we turn our talus around, and we're now looking at the lateral aspect, and we know it's the lateral aspect because we have here the lateral malleolus. Okay, so on the lateral surface of the body, again, there's a triangular, this time, articular surface on the talus to articulate with the lateral malleolus. And those are all important articulations which form part of the ankle joint itself. And then if we rotate the images again, we can look at the posterior aspect of the talus. So let's just bring that into focus. Okay, and here we see the posterior aspect of the talus. Now, sometimes you will see this an additional small bone known as the os trigonum, and sometimes you will have a sort of separate small accessory ossicle sat at the posterior aspect of the talus itself, and that's referred to as the os trigonum. So the posterior surface of the body often narrows to a particular rounded tubercle known as the posterior process, and occasionally that posterior process is a separate bone. So you may sometimes have, sorry, let me bring my pen in again. So sometimes, the sort of posterior aspect of the talus is known as the posterior process. But sometimes that may form as a separate bone, okay? And we'll put that separate bone in a different colour. So sometimes you may have a separate bone sat there, and that is known as the os trigonum. And that's in the sort of secondary ossicles that you sometimes see within the foot. But I wouldn't overly worry about it at this point. It's just being aware that sometimes you may see what looks like or may be interpreted as a fracture fragment. In actual fact, if it's smooth and well defined, it's probably going to be the os trigonum. In other words, the posterior process of the talus, which has developed as a very small separate bone. So let's rotate the image round again. Okay. And bring that into focus like that. So we've reviewed the body, the neck, we've looked at the articular facets on the medial and lateral sides of the superior articular surface of the talus there, the trochlear surface. We know on the lateral and the medial sides of the body of the talus, we've got articular facets to join the medial and lateral malleolus. We've looked at the posterior aspect. We've identified that the posterior aspect of the talus forms quite a prominent point or a posterior process, and that sometimes that posterior process forms a single little bone known as the os trigonum. Now, what we need to have a look at now is the inferior surface of the talus, and I don't see whether that's going to allow us to rotate the talus around. Okay, so we are now looking at the inferior surface of the talus. Okay, and the inferior surface of the talus bears two articular facets. Okay, now remember, this is the anterior, sorry, let me just pick up my pen. Remember, this is the anterior aspect of the talus, okay, the most prominent anterior part of the bone, and we are now looking at the bone inferiorly. We are looking at the talus as if we're underneath the patient, looking up at the patient themselves. Okay, so this inferior surface has two articular facets, 1 and 2. We can see them there. Okay, and that is separated by a deep groove called the sulcus tali. So this groove in here is known as the sulcus tali. Okay. The posterior facet is the largest of the two, and it's oval in shape and it's concave, and that will articulate with the posterior facet on the upper surface of the calcaneum. So this larger facet here, this larger articular facet, will articulate with the posterior facet of the calcaneum. Okay, so just to recap, we're looking at the inferior aspect of the talus. On the inferior aspect of the talus, we've got two articular facets. The larger of the facet, this oval-shaped facet, articulates with the posterior facet of the calcaneum. Remember, I've removed the calcaneum here, but we'll have a look at the calcaneum separately. The anterior facet here, so we've got an anterior facet. Okay, now itself is sometimes divided by a series of ridges. Okay, so it's not shown in this particular image here. Okay, but the anterior facet can be divided into a couple of ridges. Okay, and again, the anterior facet there is going to articulate with the calcaneum itself. Okay, so this anterior facet that we can see there, which I've labelled number 1, okay, is going to articulate with the calcaneum itself. Okay, and we'll have a look at those articular facets between the calcaneum and the talus in a separate little video. Okay, but all you need to know is that on the inferior aspect of the talus, there are two articular facets. They both articulate with the calcaneum. One is much larger than the other. The more posterior one is larger, but they are both going to articulate with the calcaneum itself. But the articular facet that I've labelled 1 there, that anterior facet, can sometimes be sort of separated itself by a series of little ridges. So it almost looks like different articular facets, although it's actually only one articular facet. So that's the inferior aspect of the talus itself. Okay, and I suppose we could have a look at the, if we get rid of those drawings again, which will allow us to rotate the image back again. Okay, so we're going to rotate it back into its sort of anterior position. Okay, so we're looking now at the talus again, anteriorly. We've talked about the superior trochlear articular surface. There's also an articular surface on the lateral and medial aspects of the body of the talus, and they articulate with the medial and lateral malleolus. We've looked inferiorly, and we can see that there are two articular facets inferiorly, and they articulate with the calcaneum. We can see now this head, this sort of anterior portion of the talus itself. Sorry. This sort of head area here. Okay, this head of the talus. Okay, it's directed anteriorly, and it has a large articular facet which is going to articulate with the navicular. And that's our review of the talus itself.